Let's talk about why just simply breathing through your nose can help you live a longer and healthier life. First, let's quickly go through a list of things that can happen when you breathe through your mouth from infancy to late life. Dry mouth, ADHD, snoring, cavities, periodontal disease, sleep apnea, irritability, enlarged tonsils, dry lips, bad breath, sleep problems, respiratory problems, risk of stroke, crooked teeth or a narrow jaw, long face syndrome, flat cheeks and receding chin, droopy eyes, and dark circles. All from this guy and not this guy. That's simple. Let's dive into the specifics that will blow your mind. The sinuses produce nitric oxide, which help kill bacteria and viruses that are in the air. Say what? Yeah, it's like the nose was created primarily for breathing. Crazy. It filters out dust and allergens, which is very ironic because today I'm very stuffy from something in the air. Yeah, the nose hairs that you just want to wax off probably isn't a great idea. Those are there for a reason too. So taking that off my self-care list. Oh, and mucus is your best friend too. It's also crucial for increasing oxygen levels and delivering throughout the body naturally filtered oxygen. So if there's anything you take away from this, remember the nose is for breathing and the mouth is for eating. Moving on. Less dry mouth. Dry mouth is the worst, especially when you first wake up in the morning. Breathing through your nose decreases your risk for gum disease and decay or cavities. Your saliva helps your mouth stay in that neutral pH state. Science! It humidifies the air we breathe into our bodies. Now buckle up for this one. When exercising, it's more efficient to breathe through your nose. One study found through nasal breathing that athletes didn't have to work as hard to get the same amount of oxygen, despite taking fewer breaths per minute. The reason for this is that with a slower breathing rate through your nose, the oxygen is more effective to get into the bloodstream. Mind blown, right? If you're a mouth breather, it's probably because you have a cold or the flu or allergies, deviated septum, enlarged adenoid, or sleep apnea, which would be pretty tricky to sleep with your mouth closed. So when should you get help? We all hope it's when you're a child. I work in pediatric dentistry and we're always assessing airways in children. With that being said, all kiddos should be screened as early as possible if they're mouth breathing, because nailing down the cause and intervening could save them a lifetime of oral health trouble and health risks. There are quite a few treatment options just depending on what's causing the mouth breathing. Everything from training with a oral facial myologist to mouth guards and surgeries. Some can even use myofacial therapy, which means they'll give you certain exercises to help strengthen the tongue. No matter what your age is though, it's just always good to ask for help. So if you find that it's hard to breathe through your nose throughout the day or even when you're sleeping, make the appointment with your dentist and talk about it. This way they can evaluate your airway and then maybe refer you off to someone else specifically. Comment down below what helps you breathe through your nose. Personally, I started sleeping with a tiny strip of tape over top of my mouth when I sleep, and I sleep like a baby. I religiously use my neti pot to clean out my sinuses because it helps my allergies tremendously. And now, just because I'm more aware of all the health benefits of breathing through my nose, I am more conscious of it. I close my mouth and I breathe through my nose when I'm at work and I have my mask on. I'm trying so hard to. And don't forget to come back every Thursday to a new video. See you guys.